breaking barriers and bridging the gaps between patients and doctors. Welcome to Brainstorming with the Docs and your co-hosts, Dr. Glenn Harrison and Dr. Kolby Condos.
Hey everyone, welcome back to this week's episode of Brainstorming with Dr. Harrison and Dr. Kolby Condos. I'm Dr. Kolby Condos, Dr. Glenn Harrison. How was your weekend, buddy?
It was excellent. Here in Denver, it was snowing, but it was excellent. It still is excellent. It was a great weekend. How about you?
Oh, it was good. We actually took a scuba diving class, which is pretty awesome. I didn't ever think that I would be a fan of breathing underwater, which is pretty unnerving at first, but actually it turns out it's pretty fun. So,
and you were in water that wasn't a pool.
No. So we were in a pool this weekend, but then we actually have scheduled like an open water dive.
Okay.
Go a little bit deeper, and that's how you get like your certification at the very end. You got to take a test and do like an open water dive. So
do you bring an ice auger with you when you go?
It's getting cold enough here in Minnesota that it's going to happen pretty quick. We tried to schedule the end or the checkout dive, which is the open water dive, and the guy's like, "I'm not doing it. Like, you're going to have to go somewhere else because it's really cold now." So,
oh well, look at that. Well, that'll get some blood flowing and some blood stopping.
So yeah, today's we're going to talk about a condition, or not a condition, but kind of a healthcare condition, I guess, with several subsets of conditions that we deal with really regularly, which is autoimmune conditions. If you look at the population demographics, tons and tons of people deal with autoimmunity each year. I think in a lot of cases it's maybe underdiagnosed or maybe not understood very well, which I'm pretty excited to help break some of those myths and misconceptions down, because I myself suffer from autoimmunity. I have asthma and I have celiac disease. So I am pretty excited to kind of help our viewers or our listeners or whoever's watching understand a little bit what autoimmunity is. So why don't you get started and just kind of tell everyone the general broad spectrum, what is autoimmune?
Yeah, well, thanks for the start there, Dr. Kolby. Yeah, autoimmunity it's an absolute beast. It's destroying people's lives. You just mentioned your conditions. Same with me. I told you when I found out, it wasn't that long ago, I found out I have an autoimmune thyroid condition, Hashimoto's. I just found this out, but with the proper testing, we were able to identify it, and now it's a management strategy. So yeah, we're definitely a part of this whole story, a personal experience. But autoimmunity, for those of you who don't know, autoimmunity is where your immune system decides that it doesn't like your tissues and turns on yourself. That's really what autoimmunity is where it marks one of your tissues and starts damaging it. Your immune system is a double-edged sword, the way I like to explain it. It wants to kill the bad guys, kill the viruses, the infections, and all of that. And the immune system has a memory. And if you get exposed to a cold or a flu, for example, someone brings it home. You get a cold or a flu, and then your body builds up soldiers for that specific cold or flu or virus or bacterium, and it kills it. You get sick and your immune system comes over it and it kills it, but then you get exposed to that same infection, that same virus, and you don't even experience it. And it's not that the virus wasn't there, you just don't get it. So that's where the immune system learns. So once it builds soldiers or antibodies for the infection or the virus, whatever it is, or the bacterium, it always keeps those soldiers, so you should never really get sick twice from the same virus. So that's the good side of the immune system. It never forgets. The bad side of it is if it turns on yourself, a specific tissue, because your immune system became confused, it never forgets either. So in my case, my Hashimoto's, there is no cure for it. There's a management strategies, which we'll get into. And same with you, Dr. Kolby. Celiac and asthma, you don't have a cure for.
No, it's kind of the pits actually. Really kind of limits your diet, or anyone who suffers from from celiac disease or any sort of gluten sensitivity. It really limits what you can eat. But that being said, like you said, where the immune system is kind of all or nothing. Once you are subjected to that infection or that perceived infection, you are always going to have those soldiers or the antibodies, right? So every time I eat wheat, I trigger an immune response. The problem with, and so I guess I'll kind of go on this tangent, right? Because we're already here. When you look at how autoimmunity kind of happens. What happens is your immune system can, in some cases, confuse your tissue or the healthy tissue in your body for a pathogen or for like the bad guy, right? So, you know, if you have something that's shaped like this and your tissue is shaped like this, your immune system isn't specific enough to go, oh, that's the left fist and this is the right fist. It just says that's a fist, get rid of it.
Yeah.
So when this happens, you know, for instance, celiac disease, if you react to transglutaminase 3 and you make an antibody, well, then that actually is cross-reactive with some of the mucosal cells in your gut and causes a overly porous gut, and that's how you get leaky gut or celiac disease. And that's when you get irritation in the small intestines and the colon. So that's part of how that autoimmune condition happens. In Hashimoto's, you know, you are subjected to a pathogen or an infection or something like that. Your immune system ramps up, and then your immune system confuses healthy thyroid tissue for an invader, for a bad guy, and it starts destroying that as well. So then you have issues like hypothyroidism.
Exactly. So just for the audience, autoimmunity is where your immune system attacks yourself. We gave a few different scenarios. And you talk about triggers, viral triggers, bacterial triggers, something that excites the immune system. There can be many different things that'll be that trigger. There could be, I like to break it down into 3 stressors: a physical stress, a chemical stress, or an emotional stress. Now, these are big areas, but something to irritate your body. I know in your practice, Colby, you've seen things like this, but I've seen bankruptcies. I've seen divorces. So heavy emotional burden, the loss of a loved one. Any of those things, those emotional traumas are enough to shake up your immune system, to shock it so much where the immune system becomes confused. It becomes hyperactive. I like to say your immune system is a security guard, and he has his finger on a hair trigger of a gun. And as soon as you flip that switch, the immune system looks at anything that even remotely looks abnormal. And once it marks it as bad, it never forgets. So these, don't ignore emotional triggers, but bacterial infections. I've seen Lyme disease, traumas, physical traumas, car accidents. Dr. Kolby, tell me your experience about TBIs and autoimmunity.
Yeah, absolutely. TBIs. And another big one that I've seen is actually pregnancy. You know, pregnancy is a huge one. I have a patient actually that came in probably 2 weeks ago. And after pregnancy, you know, her hair's falling out, all this weird stuff. And she's like, I don't know what's going on. Like, everyone says it's postpartum depression. Let's get some labs. I run the labs. Oh, she's got, you know, hypothyroidism. She's got Hashimoto's. So, I mean, it can be anything. Your body doesn't differentiate. And that's the part of the neurology part of it that comes into it, is your body doesn't differentiate between stress. Your brain and your body doesn't know the difference between you studying for a calculus test and you being mauled by a grizzly bear.
That's right.
Yeah, exactly. Stress is stress. They don't care what kind. They just know that it's stress.
Mm-hmm. So yeah, these stressors, physical, chemical, or emotional stressors, can put you over the edge. And autoimmunity, most people don't know if they have an autoimmune disorder till the tissue stops functioning or slows down in its function, and then the symptom arises. So they don't have the pre-screening, the blood work to test. Luckily for me, I was just doing a screening, some blood work, and I tested my thyroid antibodies, and there they were. So my thyroid is still functioning optimally, but my immune system is damaging it. It's damaging it. So everything that I have to do is to try to pull away irritation from the immune system so it doesn't attack myself as much, or I can preserve that tissue. Maybe we should jump in. What are the most common autoimmune conditions? We talk about autoimmunity being this big pool of disorders, but maybe for the people listening, what are some of the ones that you see regularly?
Yeah, so I would say probably the most common autoimmune condition I see by far is Hashimoto's, which is a thyroid disease. I regularly see actually like a gluten sensitivity, not necessarily not necessarily celiac, but they still react positive to certain strands of protein and peptides and whatever in the gluten complex, I guess, you know, whether it's gliadin.
Gluten necklace, I call it.
Yeah, the mess, right?
Yeah.
So I see a lot of gluten sensitivity. I see a lot of, actually, I just ran one where the patient came back to like a connective tissue autoimmunity. So that was going to be at risk for like atherosclerosis or like hardening of the arteries with some stuff in her heart. Yeah, I'd say that's probably the most common is the Hashimoto's.
Yeah.
And then, you get some weird ones in and out of there. So
Yeah, some of the ones that I've seen in my office are a lot of polycystic ovarian syndrome, a lot of endometriosis, so a lot of female reproductive organ tissue autoimmunity, and then we get into the MS and celiac disease, see a lot of Crohn's, ulcerative colitis, see a lot of that. And I don't even know what the name of it. They don't even have a name for it, I guess. But antibodies to the acid-producing cells of the stomach. They're like, is there an autoimmune name for those parietal cells and
yeah, parietal cell
factor?
antibodies. I don't know if there's a specific name for it or a condition
maybe,
for it, but
yeah, maybe that's an important point too. Autoimmune diseases are based off the name. So these names that we've been throwing out, they're named after, they're determined. The name of the disease is specific to the tissue that's being attacked and the way the tissue is being attacked. So when it comes to autoimmune disease, there's millions, billions of tissues in the body, and there could be multiple ways of each tissue being damaged. So when people ask me, I want to be screened for all autoimmune diseases, well, that would take billions of tests that we don't even know. So there can be a lot of autoimmune conditions people are suffering with that they don't have a label, and usually what they say, it's a name, it's some kind of name, but they say it's a non-specific inflammatory condition of this tissue, and then that's just what it is. And you just have to live with this autoimmune disease, and we don't know what causes it. We don't know anything about it. Just it is what it is. And you see things like lupus and stuff like that.
Yeah.
And so many more, and people are just suffering. So autoimmunity is real, but the common denominator is the cause of it.
Right. So, and at the end of the day, it's just your immune system attacking healthy tissue. I think that actually after you talked about it, I see a ton of patients with MS. I don't even know how that slipped my brain, but when you look at it, and MS is a great example because there's a lady that I actually follow her work a lot. Her name is Terry Walls. She's an MD. She actually is an MS sufferer herself, and she actually she worked for the University of Iowa at their medical facility. So she had the access to the latest and greatest treatments of autoimmune conditions, specifically MS. She went and she did all these treatments, and she just deteriorated. She had active lesions. And what MS is, for those of you that don't know, is actually a condition that affects the insulator called myelin, which wraps around your nerve. So it can, you have a variety of symptoms, whether that's like loss of motor function, pain, stuff like that. But she actually went into a wheelchair and was unable to walk. Well, then she went on and did all this research and actually figured out a way that she could remove some of these triggers from her diet and from her lifestyle, and she could start implementing healthy nutrients back into her diet. And she actually was able to counteract or not necessarily stop, but maybe reverse some of the symptoms associated with the autoimmune condition MS. So it is possible if you do the right things to kind of slow or even reverse some of the symptoms of your AI condition.
Exactly. So, we have all these diseases that we're talking about, and they're all hitting different tissues. So, you'll see the celiac disease, the Crohn's, ulcerative colitis, the multiple sclerosis, polycystic ovarian syndrome, Hashimoto's, all of these autoimmune conditions, rheumatoid arthritis, if I didn't say that already, their conventional medical model looks at each disorder, like rheumatoid, it likes to affect the hands, wrists, and the neck. It can affect other areas. And then they'll give steroid injections, we can talk about those, but they'll give all those injections on the tissue that's being damaged to try to mitigate some of the symptoms. They can be very helpful. But if you have one autoimmune condition, there's a 50 to 60% chance you're going to have another one, because that immune system is confused, and they mark one tissue as bad. There's a high probability it's going to mark other tissues as bad. I've seen a lot of people in my office where they have multiple autoimmune conditions. And kind of like your case, Dr. Kolby, you said asthma and celiac, right?
Yep, absolutely. I got both of them. It stinks.
Yeah, so these autoimmune conditions can keep stacking, and then there's a therapy for this disorder in this tissue, and then a steroid, usually steroids or immunosuppressants for this tissue and this tissue. But at the end of the day, it's never the tissue's fault. It's
Yeah,
just trying to
exactly.
do its job. It's that darned old immune system that
The immune system.
yeah.
And the
So if
last
you,
thing you want is an immune system that doesn't work at all, right? Because you have to
right.
have it.
So that goes into conventional medical treatment. So how does the modern or conventional medical model deal with autoimmunity?
Yeah, so I mean, it just looks at immunosuppressant therapy. You can use immunoglobulin therapy. I've read a couple of studies where they use that for like anti-NMDA receptor antibodies in the central nervous system. There's actually a book that was written about it called Brain on Fire. If you guys have a chance, you should go read it. It's a great book. It's about a girl who got antibodies to the receptors in her brain, and then she basically, went. She was bipolar. She was hallucinating. I mean, it's a whole list of really crazy symptoms that she was having, and they discovered it and treated it with immunoglobulin therapy. But yeah, I mean, the basic, Western medicine is just drive down the immune system so that it doesn't function properly. But you don't necessarily want that, because then you're going to get sick from everything.
Mhm. Yeah. So immunosuppressants and steroids, they do wonders, but they can't be prescribed for a long term, because your body will fall apart. Drugs like prednisone will create osteoporosis, and you'll create diabetes from it. That's just one nasty symptom of some of these drugs. There is a place for them to cool the immune system, but it can't be used long term. So
Right. If you have active lesions and you have MS, you can bet that I would recommend you go and get a steroid, right? Because you want to preserve as much of that as you can. But that's not a long-term treatment plan. That's not a long-term strategy, because it's going to cause so much damage to other stuff in the meantime. So if you can come up with other strategies or treatment modalities in addition to that type of emergency medicine, that's ultimately the best idea, in my opinion.
yeah. So we talked about how with the conventional medical model approaches, because I know people are going to be watching this or listening to this, and they're going to say, oh, I have autoimmune disease. What is the trick? I get this every day. I know you do as well. So imagine Mrs. Smith walks in your office and she has Crohn's, and I don't know, and she also has, I don't know, we'll just say ulcerative colitis, two autoimmune conditions. What is going to be the treatment strategy for her, Dr. Kolby?
So,
spot.
yeah. Thanks. So for my treatment with a lot of my autoimmune patients is I try to basically heal barriers, because you want to stop any sort of, perceived pathogen or real pathogen, right? So you want to stop any bacteria or virus or fungus or anything that your immune system can perceive as a potential threat. You want to eliminate or slow that part of it down. So I try to heal their barrier, heal their guts, heal their mucosal linings. Rule number 2 I do is I run some basic blood work to make sure they're not anemic, stuff like that, because if you're anemic, you're not going to heal anything. And the third thing is I try to figure out what the environmental triggers are that maybe has progressed the autoimmune condition or exacerbates it. So, for someone who has celiac disease or Crohn's, one of the things that I would suggest them eliminating is pro-inflammatory foods, or foods that have a high clinical correlation to cross-reactive antibodies. So gluten, dairy, stuff like that. And you can do blood work for that. And I do that a lot too, because then it's a little bit more specific and the patients know exactly what they should be removing from their diet, because then they know what their immune system is sensitized to.
Yeah. So they have a template. I follow a similar pattern. When they come in, I give them a whole host of paperwork, and then I find out there's all these autoimmune conditions. So I start asking them about everything in their life. Because remember, physical stressors, chemical stressors, emotional stressors. So I have seen people in my office, and I know you have too, Dr. Kolby, where people do really, they might be doing good when they identify foods that are irritating their immune system. Because remember, that security guard turned on us, and we don't want to aggravate that security guard. We don't want it to go to sleep, because it still has to save us from the enemies on the other side of the door. But we don't want it to be hyperactive and have its finger on the hair trigger to start going off on our tissues. So looking at those foods, testing to find out where if there is any foods, sometimes chemicals. I have seen people where they do really good, where we do all of those things, but we're not quite there yet. And then I find out that maybe their significant other isn't so much of a great significant other. They've had relationship problems, or they're mourning the loss of a loved one, or they're going through financial hardship or some big emotional burden. That will sabotage all efforts. There was a lady that I was working with, and she was in northern Colorado. Well, actually, she was in central Colorado, and she was taking care of she was helping her mother-in-law move out of her place in the northern part of the state. And her husband was away on a work trip, and she was doing great. She wasn't when she came in. She was having 6 to 7, super urgent bowel movements a day. This is 30 years. Okay. It was severe. She aged very quickly from it because of all the natural lack of nutrients and everything. Her body was falling apart, really it was. In 30 years that she never really left her home with this condition. And then when she got better, she was down to 2 non-urgent bowel movements. It took months, but we got there with looking for all these triggers, obvious triggers and tests and everything was good. And then she went to help her mother-in-law move. I guess she didn't get along with her mother-in-law that well. And she was only there 2 days, I believe. And she called me in a bit of a panic. And she said, Dr. Harrison, my stomach is everything reversed. She was good for a few months. And I said, well, what do you mean? She said, I'm doing everything. I'm watching what I eat. I'm doing my meditation. I'm following my sleep. I'm staying away from these chemicals. I'm sleep patterns, on and on and on. And I said, well, how is the move going? She said, oh, it is absolutely horrible. And I said, what do you mean? And she said, my mother-in-law is the most difficult person ever. I'm not getting any sleep. And then she just paused. She realized what was going on. The emotional stressors from being in that environment threw her over. It put her over the edge, and she had all those autoimmune flares again in her stomach. Within a matter of days, was going back to the multiple bowel movements and diarrhea. And she was even passing blood again. And I said, you got to get it out of that environment immediately.
And like you said, it can be more than one thing too. I don't want everyone to think that it's one specific stressor.
Yeah.
I actually had a patient that came in today, and she'd quit her job. She got a job as a traveling surgical tech. So basically she would travel to different parts of the country and assist in surgeries. And she came into me, she's from the area, and she came into me and she goes, I don't know what I'm going to do. I'm having all of these reactions to, my gloves and actually to the soaps. So, when we talked about it, we broke it down, the stress of her quitting her job that she'd worked at for years and years and years. Mm-hmm. The stress of all of a sudden they're leaving their home, which they've lived in for, 20, 30 years. They're going to move into a motorhome and they're going to travel across the country. Each, every 12 weeks or whatever her rotation is, she's moving into a new system, a new hospital system, new staff, new faculty, new procedures. That's stressful. The stressful part about her trying to maintain a healthy diet and lifestyle. And then on top of that, you throw all this on top of that, all the chemicals from the soaps, the disinfectants, and the gloves. And actually, we just got the blood work back today. She is immunoresponsive and reactive to some of the chemicals that are in the soaps and the gloves. And she's actually she's physically incapable of wearing those gloves because it actually makes her hand swell up.
Yeah.
Her hands were so large. She went from a small to a large in rubber gloves because her hands would swell that large.
Okay. Yeah. Wow. Well, thanks for sharing that. There's another thing. A lot of people, I know you see this when they come in, they may have a diagnosed autoimmune condition, and they're usually tired, exhausted, or they're exhausted and they maybe don't suspect an autoimmune condition because the testing hasn't been done. That's a common symptom that I see, and the immune system needs all your immune system has the opportunity to take every energy resource in your body to fight the evil enemy. And that's why a lot of people dealing with autoimmunity are tired, because the immune system is busy fighting you, and therefore it takes your energy. So that's one thing to look at. Another thing is, I know some people are going to be listening to this and then maybe they don't have something, but they're worried, or they have one autoimmune condition. They're worried they're going to have another. There could be, but I would, recommend do a full blood panel, do a screen. And if you have autoimmunity and you have children, get them screened when they're the right age. And even 3, 4 years old, you can do a lot of these screenings because you want to know if their immune system is attacking their tissue, and it can be passed down from mother to child pretty easily. In fact, my mom, we found out she had Hashimoto's too.
Right.
When we were screening her. I don't know if she gave it to me or it was just some stress or trigger in my life.
Well, even like with my daughter, I have a 2-year-old, and we just don't, she just doesn't eat wheat or dairy because I'm allergic to wheat and dairy. You know, I have an immune reaction to wheat and dairy. So we just avoid those things in our house. Now, I mean, is it or isn't it? I don't know. I mean, she could be, she could not be, but the likelihood of her being maybe more sensitive to it is higher. So we just don't eat it.
Yeah. Yeah, exactly. And then the next thing is, what do you do if you have autoimmunity? Any of these triggers we talked about, anything in your environment, I've seen chemicals do it. In fact, there was a lady in Minneapolis. I don't know if I ever told you about this case, Dr. Kolby. There's this lady, she came in, we thought she had a dairy intolerance because dairy was bothering her. But the labs didn't say that, and it just didn't add up. And then had a really in-depth conversation with her about, what kind of dairy she's consuming. And she said, the weirdest thing, Dr. Harrison, when I drink milk out of a milk jug, I'm fine, like a plastic container. When I drink it out of a milk carton, that's when my problems start. We found out that there was glue leaching, micro amounts, leaching into the milk from the milk carton, and that was one of her triggers manifesting the symptoms. So yeah, you can go on quite the hunt for this. So I guess if you do have an autoimmune condition, look for somebody who's going to identify triggers. You can't cure it. You're going to read books on how to reverse your Hashimoto's and how to reverse Crohn's and all that. They don't exist. You got to manage them, and you got to manage your immune system. So, I don't know. I just see that all the time, and, do the proper testing, look for triggers, and then, the triggers are there. Pull those triggers out, whatever they are. They could even be a person, right?
Right.
Person.
Yep, it very well could be. And everyone wants the simple answer. There isn't a simple answer.
Yeah.
For this. I mean, as someone who suffers from it, it stinks, but it is what it is. Mm-hmm. Your health is worth it long term to just remove that stuff from your life. It's not that difficult for me to go, I'm not going to eat that piece of bread because I know that I'm going to just pay for it, and it's not going to be a one-time incident. That's what a lot of times when people are like, it'll be, I'll just cheat this one time. That incident is not limited to one time. That is going to extend through the whole immune cascade.
That's right.
It doesn't just happen for 10 minutes. It's going to be a prolonged experience for you. So just if you have an immune trigger and you know what it is and you have an autoimmune condition, just avoid the triggers.
Mm-hmm. And some people don't. So go get the testing. And maybe we're going to wrap things up. If people are looking for testing, Dr. Kolby, how can they reach you?
Yeah, so you can get us on our website. Our website is www.northlakeschiropractic.com. You can find us on Facebook. Our Facebook is North Lakes Chiropractic and Functional Neurology. If you guys are in Grand Rapids, Minnesota, stop by. We'll have a conversation. What about yourself?
If they're on the other side of the country, a little farther west, anywhere near Colorado, or we work with people all over the country. We can do tests pretty well all over the country. Probably visiting our website, a lot of information there as well. That's www.drgharrison.com, or just Google the Center of Functional Medicine, Denver, and you'll find us. And there's a lot of resources there.
Awesome. So if you guys got value from this, please share it with anyone that that might have an autoimmune condition, anyone that might, you might think have an autoimmune condition. And as always, stay tuned because we are going to do another one here shortly. I think I don't even know what we're going to do it on, but we're going
to be doing on adrenal fatigue.
Oh yeah.
Adrenal fatigue.
That's going to be a good one too. So stay tuned and obviously keep watching, and thanks for watching.